Now, while in the 50s, the talk about cesarean section was all about its dangers, by the 1970s, this had changed into talk about how safe it was. Now, there's a few things that happened in these 15 and 20 years, which is that Singapore became independent. There was new maternity hospitals being established. There's also an increase in commercialization, so there were more medical technologies coming into Singapore, much like how it is now, where you have pharmaceutical companies and other medical technology companies setting up shop in Singapore. Back then, it was also seen as a wonderful potential place for medical technology to grow. So the first article we have is from Berita Harian, the Malay newspaper, 12 June 1974. And the title says, "Now more mothers are giving birth through surgery." More mothers are giving birth through cesarean surgery at Kandang Kebau Hospital in the first 5 months of this year compared to the same period of last year. From January to the end of May 1974, there were 716 cesarean births at KKH compared to 703 in the same period a year ago. A representative from the Ministry of Health has stated that 716 cesarean births were among the more than 8,000 births in KK Hospital in the same period. In only 1973, what is this, 900, is it 1,970 cesarean births were done by obstetricians. These cases of cesarean births seem to be increasing these last few years. And the hospitals are arranging the data, they are analyzing the age ranges of the mothers who give birth through surgery, said the representative. One source from KK Hospital stated that usually mothers who have certain diseases that are found to negatively affect birth will be operated on by doctors in order to ease the process of birth. Mothers who are pregnant and found to face high blood pressure or heart disease usually will undergo cesarean section. The same goes in order to avoid postpartum hemorrhage, said the source. He also emphasized that another factor were pregnant mothers. Oh, this is repeated. He emphasized that another source were pregnant mothers with babies who are found horizontal. That means a transverse lie, so not the head nor the butt facing the cervix. They need to be operated on in order to facilitate birth. However, this can be avoided if these mothers go for prenatal visits, early prenatal visits, because the position of the baby can be corrected if needed, he said. So yes, the transverse lie or the baby in a horizontal position is one of the medically indicated medical indications for cesarean. It still is now. As for high blood pressure, it depends because you have high blood pressure that can be managed, and then you have extremely high blood pressure, which is one of the signs of preeclampsia, which is definitely a medical indication for cesarean birth. But that being said, who can tell the difference between high blood pressure um, and sort of being encouraged to have cesarean birth as prevention rather than a true case of preeclampsia? Next, in the New Nation newspaper, 10 of March 1976, rate of cesarean births are up by 100%. About twice as many women in Singapore give birth by cesarean operation today compared to a decade ago. According to figures released by KK Hospital, there were 1,487 cesarean births last year. This means that 6.4% of the 23,000 babies delivered there were by cesarean. The figure is at least double that in private hospitals and clinics, say doctors. But wow, 6.4% cesarean rate, that is amazing. Because right now, World Health Organization recommends a rate of 10 to 15%. And in Singapore, I believe the overall rate is almost, I think it's just under 40%. But yes, it is higher in the private hospitals. So same, this figure is at least double that in private hospitals and clinics, say doctors in government practice. This is part of a worldwide trend. The main medical reasons for the rise in the high cesarean birth rate here and elsewhere, according to senior government consultant obstetrician Mr. T.H. Tian. Yes, we saw him just now. Oh no, I think it was in the other video about we saw him earlier about the new drug introduced in Malaya. So the main reason, he said, is the development of anesthetics and antibiotics to the point where a cesarean is now relatively riskless. For a full report on cesarean births and the controversy that its rising rate has generated, see pages 10 and 11. I mean, wow, looking back, 6%. And they were so concerned. Next one is from Berita Harian, the Malay newspaper. And it's from 1976. And the title is, the headline goes, surgery finally reveals why she had stomach pains. With every second, minute, and hour, the days passed, the weeks and months, the years passed. And these last 5 years, Madam Malay Warimwaha, 52 years old, often felt pains in her abdomen. The stabbing pains didn't go away. She went to see a doctor, not just one, but several doctors, for treatment. But all the doctors she met all said that she had no illness. Her stomach appeared normal, these doctors said. But the stabbing pains did not go away. Malay went to Damunan Saduak Hospital in Ratchaburi, Muang Thai, in Thailand. At this hospital, these doctors did a surgery after thoroughly examining her stomach. Oh, I guess her abdomen. My goodness, the surgeons were shocked. They found in her belly a pair of operating scissors, which were 15 centimeters long. In fact, Madame Malay had undergone a cesarean operation about 15 years ago. So in 1960, it was done by a doctor in Hospital Samut Songkram. This elderly lady further elaborated that she did not feel any pain after the cesarean operation, meaning she did not feel anything left in her abdomen. Her health was good and she seemed to recover as per normal. Only 10 years later did her abdomen start to present with stabbing pains. With every day, these pains became clearer. She met not less than 12 doctors in her area. She also met with dukun-dukun or healers in her village in case these pains had a supernatural cause. You can see in the picture, these are the forceps that were left. Oh, okay, it says operating scissors, but okay, here it says forceps that were left in Madame Malay's abdomen. She was afraid that these pains could have been some kind of a black magic, but it seems all her efforts were in vain. Not a single doctor or healer was successful in treating her. At one point, she truly could not stand the pain. She felt a hard object in her belly. Without waiting further, her husband, Ratuan, brought her to the hospital. Finally, the mystery of her pain has been revealed. So this story actually kind of fills in the information because I only found articles from the 50s and the 70s, but since this operation was done in the 60s, we have an idea of what is happening in this time. Although this happened in Thailand, but the 60s were like a period of transition. So from talking about the operation as a purely dangerous surgery, we have doctors starting to perform it, but then it seems that okay, they start to make some mistakes, right? As you see the article about the drug, the wrong drug was given. It was a new drug. So we can say it's experimental, right? In Malaya, it was not used before. And in this case, a pair of forceps was left in a woman. And why would the Malay newspaper republish this if not to give a kind of warning to women who are having cesarean surgeries? Because we see that in the 70s, the rate started to increase. From one year to another, it went up by 100%. So it's doubling per year. Although it is still low, around 6% of all births were cesarean.